everyone, so let's move towards our today's topic, which is,
first of all, before starting this topic, you have to understand some things, some important things related to this topic. That, as you know, that there are total 6 pharyngeal arches, out of which the first, second, third, fourth and fifth and sixth, okay, total 6 pharyngeal arches होती हैं, जिसमें से जो 5th pharyngeal arch होती है वो degenerate हो जाती है, regress कर जाती है, okay. So the remaining one are first, second, third, fourth and the 6th pharyngeal arch. That means total there are 5 pharyngeal arches. Now what happened at the level of between these, as you know, there are pairs of pharyngeal arches. So between those pairs, primordial pharynx is present, okay. Primordial pharynx is present, and at the level of first pharyngeal arch, on the ventral side of the primordial pharynx, what happened, a swelling will appear, okay, and that swelling is called as median lingual swelling. This all is happening at the end of the 4th week of development. So what happened, I am repeating again, वेंट्रल साइड जो होती है प्राइमोडियल फेरिंग्स की, वहाँ पर स्वेलिंग अपीयर होती है एट द लेवल ऑफ फर्स्ट फेरेंजियल आर्च. On each side of the median lingual swelling, another swelling will appear, and that is called as lateral lingual swelling, okay. Lateral lingual swelling will appear on the each side of the median lingual swelling. Now obviously on each side it will be present, so there are 2 in numbers, so they both will fuse, the lateral lingual tonsil will fuse together, and they will merge, and they will form the anterior part of the tongue. As you know that tongue is divided into 2 parts through sulcus terminalis, a V-shaped line, and that part is anterior 1/3 and posterior 1/3. Anterior 2/3 and posterior 1/3. So anterior 2/3 part is formed by the lateral lingual swelling, okay. Now what happened further, that when these 2 lateral lingual swelling fuse, and they will form a line on the tongue, and that line is called as lateral lingual septum, okay. So you have to remember this point as well. Now, like I told you that there are total 5 pharyngeal arches, okay. The above 4 pharyngeal arches, between the above 4 pairs of pharyngeal arches, what happened, primordial pharynx is present, and in that swelling will appear, and so on. Now first pharyngeal arch, you have to remember this point, first pharyngeal arch is supplied by 5th cranial nerve, that is trigeminal nerve, okay. Then 7th cranial nerve will supply, the 7th cranial nerve, which is facial nerve, will supply the 2nd pharyngeal arch. The 3rd pharyngeal arch is supplied by glossopharyngeal nerve, and the 4th pharyngeal arch is supplied by 10th cranial nerve. Now if you remember this shortcut, this topic, this concept, if you know this concept, it will be very easy to memorize the nerve supply of the tongue, okay. Now like I said, anterior 2/3 of the tongue is formed by the fusion of the lateral swellings, okay. Now 2 lateral swellings are forming the anterior 2/3, and that anterior 2/3 part of the tongue is supplied by 5th and the 7th cranial nerve, okay, because it is present at the level of the first and second pharyngeal arch, and first and second pharyngeal arch is supplied by, first is supplied by 5th and second is supplied by 7th cranial nerve, so they will supply to the anterior 2/3 part of the tongue. The sensory supply of the anterior 2/3 part is supplied by 5th cranial nerve, okay, and the and the seventh cranial nerve will supply the motor supply of the tongue. Okay, now after that obviously first pharyngeal arch के level पे तो क्या बन रहा है, anterior 2/3 part बन रहा है. सेकेंड pharyngeal arch के level पे copula बनता है, which is also the part of the anterior 2/3 part. But remember that copula will degenerate soon. Okay, as soon as it develops, it will degenerate in after the formation of the other structure. Okay, now after the formation of copula at the level of third and fourth pharyngeal arches, hypoglossal eminence is formed. Okay, at the level of third and fourth pharyngeal arch, hypoglossal eminence is formed, and that hypoglossal eminence forms the posterior 1/3 of the tongue. Okay, anterior 2/3 part of the tongue is formed by lateral lingual swelling, and the posterior 1/3 part of the tongue is formed by hypoglossal eminence or hypoglossal swelling, and that hypoglossal eminence or swelling is formed on the ventral region of the third and fourth, at the level of third and fourth pharyngeal pouch, for third and fourth pharyngeal arches. Okay, and the nerve supplies the posterior 1/3 tongue is supplied by glossopharyngeal nerve and vagus nerve. Vagus nerve is 10th nerve, and glossopharyngeal nerve is 9th nerve. As you know that it is forming at the level of third and fourth pharyngeal arches, so third pharyngeal arch is supplied by glossopharyngeal nerve, and fourth pharyngeal arch is supplied by vagus nerve. So they both will supply the posterior 1/3 of the tongue. Again repeating, anterior 2/3 lingual tonsil बनाता है, lingual swelling बनाती है. Okay, and lateral lingual swelling, and the posterior 1/3 is formed by the hypoglossal eminence. Anterior part of the tongue is supplied by fifth and seventh cranial nerve, and the posterior 1/3 part of the tongue is supplied by glossopharyngeal nerve and vagus nerve. And one more point, the muscles of the, as you know that there are muscles of the tongue, so those muscles are supplied by hypoglossal nerve, which is the cranial nerve number 12. So this was the whole topic regarding the development of tongue. You have to remember, till then, work hard, study hard, and good luck. Take care. Bye bye.